Thank you for tuning in to this SJSU podcast for October's Intimate Partner and Domestic Violence Awareness Month. My name is Emily, and I am the Wellness and Health Promotion Coordinator in the Student Health Center. I'm excited to introduce today's conversation, which explores the intersection of the COVID-19 pandemic with intimate partner and domestic violence related services. Now more than ever, it's important that we are aware of the resources available to us and the ways that we can support each other. With that in mind, we welcome guest collaborators from two organizations that provide vital services to our local community: Nextdoor Solutions and YWCA of Silicon Valley.
Well, welcome everybody. This is our podcast for the SJSU's Intimate Partner and Domestic Violence Awareness Month for 2020. We have some great guests with us here today, and we're going to be talking about the impact of COVID on families and individuals in this time. My name is Bonnie Sugiyama, and I'm the director of the Pride Center and the Gender Equity Center. I use the pronouns of they and she, and I'm going to throw it to Emily to introduce herself.
Hi, my name is Emily Rosenfield. My pronouns are she, her, and I am the Wellness and Health Promotion Coordinator in the Student Health Center at SJSU.
All right, now I'm going to throw it to our guests to introduce themselves. Go ahead, Laura.
Hi, everyone. My name is Laura Diaz, and I'm the Outreach and Volunteer Coordinator at Nextdoor Solutions to Domestic Violence. My pronouns are she, her.
Hi, my name is Daniela Castañeda, and I am the Community Engagement Promotoras Coordinator at YWCA Silicon Valley, and my pronouns are she, her, and ella.
Thank you. Thank you so much for joining us today. Your organizations are both really important in our community. Can you both tell us a little bit about the roles that you have and a little bit about yourself and like kind of how you got into this work? Yeah, okay.
Yeah, okay. So as a community engagement coordinator, specifically working with the Promotoras program, my role is to, I work primarily with the Latinx community. Specifically, it's to recruit women that only speak Spanish, and we educate them and provide the tools so that they can learn about the issues of domestic violence and sexual assault, and about violence in our culture and our communities. And from there, then they have this knowledge to be able to go into their own communities, into their own families, and this information. From there, that is how we change culture. That is how we heal generations. And so they're able to talk to their children, they're able to talk to their partners, they're able to talk to their friends, their church members, their the PTA school members. And that is how we are healing communities. This is how we are changing communities. And the beautiful thing from this is that it's happening in an organic way of people in their own communities doing it, and not having like an outsider person coming and telling them what to do. And that is the first part of it. The second part, or the second goal, is that in doing so, we are kind of normalizing to be able to ask for help. And they serve as a bridge between our services and the Latino community, so that people feel comfortable reaching for assistance. And not just that, but they have someone there that knows exactly what to say and where to lead them to. And so in that way, being able to connect survivors to our services, and to be able to do that in Spanish.
That's great. Laura?
Again, my name is Laura, and just to share a little bit about myself and how I got into the work of domestic violence. I've been at Nextdoor Solutions for a little bit over a year, but I used to work at Nextdoor back in 1996, and I worked here for about 7 years. And I started as an advocate, not knowing anything about domestic violence other than what you hear, on TV or on the radio at that time. And so when I got involved in the work, for me, it was very individual. It was very how can I advocate for this person individually? After I left Nextdoor, I worked in other agencies. I always considered myself an advocate at heart. It's the work that's guided my career and different jobs that I've had in the community. And when I came back to Nextdoor last year, what really for me motivated me to come here was that our mission at Nextdoor is very short, right? It's to end domestic violence in the moment and for all time. And so when you look at that mission, it's so loaded, right? Because how are you going to end that? And for me, what I really appreciated is that it connected with my values about when we talk about ending domestic violence in the moment, we're talking about emergency services, right? It could be a shelter, it could be a restraining order. It's the things that are, if we don't do these right now, it could be life-threatening for somebody in our community. But then when I look at the second part of the mission, it's for all time. And that for me means that we need to work dismantling systems that keep people oppressed, right? We have to dismantle the racist structures we have, the sexist structures that we have, the inequity that we have in our communities. Because if we don't address those three things as pillars, the prevention work that we do is never going to get us to ending violence, right? And so for me, the work that I'm doing here at Nextdoor really combines both things. I'm tasked with running our 40-hour training, which to me is something that you're bringing new people into the movement to be advocates, which is to me is a very special thing. I also work with our promotoras. Our promotoras are considered leaders in our community. Promotoras of health are basically out in the community educating community members because they've experienced something themselves, right? And so the community leaders know what it is to come for services. They know the systems that are oppressing them. And they're there at the front lines using knowledge to really let people know that they have personal power, but that collective power gets things done. And so for me, it's really exciting to be working with our volunteers and community, but also with this small group of mujeres that are super strong, that really get it, right? Like for us, it's more about the community informing us as opposed to us informing the community. You know, I can sit here and say, well, I've been doing this work for 25 years, but I may still have some ideas like, yeah, we've been doing it that way, let's keep doing it. And you have people that have not been invited to the table. And primarily those are you know, our indigenous community, our Black community, our people of color. And so inviting folks to the table when they haven't been in the past is really shifting those power dynamics. And for me, that's the exciting part of the work.
Yeah, that's great. I think both of you talked a lot about like that idea of community empowerment and self-advocacy. And those are the things that we know really contribute to community change. Laura, you were talking about the position of an advocate. Can you elaborate on what that, like what advocates do in like that 40-hour training that you referenced?
Yeah, so our advocates are really at the front line of meeting with clients that are in crisis, with folks that are in crisis at the moment. And what that means is, for me, it means, you know, when I became an advocate, I remember having a checklist and I had just gone through the training. I'm like, I'm ready. Like, what do I need to do? Get a restraining order, get housing, you know, all these things that we feel like this person should want these things. And so I quickly learned very quickly that an advocate is there to witness, an advocate is there to hold space that is sacred space. When somebody's telling you that the person they love is hurting them and they're trusting you with that, that is something very, very sacred to me, right? To that circle that we're building, that community we're building with that person in that time. And so yes, an advocate is going to be able to find services, connect you to services, join you on your journey, start from where you want to start, right? But when it comes down to it is having a person walk alongside you, witnessing your pain and showing you that you have the power, right? If you wanted to change things. And so for me, being an advocate is, yes, all these checklists and all these things we need to complete. And, you know, the grant says we need to do so many things. Great, that's awesome. But at the core of it is really this love for community and wanting to see our community members safe, in safe relationships and healthy relationships, whatever that means for them. Whether that means staying with their partner and changing those dynamics or leaving their partner, right? So for me, that's what an advocate means.
I love that description of an advocate. It's more than just the things that need to happen, but it's that caring, that holistic approach to supporting somebody, right? So you all talked about the programs that you're a part of with your organizations. Can you elaborate, like, kind of more like the overall, like, maybe not overall, because you kind of elaborate on the mission specifically, but like, what other programs and services do your organizations offer and support?
So YWCA, we offer services for domestic violence, sexual assault, and human trafficking. We understand that it's an intersectional approach. So if there is intimate partner violence, it might also be sexual assault, it might also be human trafficking. And we offer services to everyone that needs it, regardless of age, religious backgrounds, or their ability to pay. The majority of our services are free, with the exception of our healing center, which is our therapy services. But it is on a scaling side, and we're never gonna refuse services to anyone if they're not able to pay. So the services that we provide is kind of where what we go is what do we have to do to get to have the survivor transition to a life that is free from harm. And for some survivors, that might just mean a one-time interaction. It might just be accompaniment to an examination, accompaniment to a police detective interview. For others, it might be a 1 year, 2 year long-term case management, intensive case management. In others, it might just be hearing someone express to them how they feel. We work in that holistic approach, allowing the survivor to take the lead, and we're just there to support and offer resources and bouncing back ideas. The thing about advocates is that we're confidential, and so survivors are able to really go over their options with us in a safe manner that doesn't involve the police if they choose not to. So some of these services that we provide is case management, and as I mentioned, it can mean a lot of things. That could be from learning how to ride the bus to getting a new job, finding daycare for your children, safety planning so that you are safe, whether that's a long-term plan to leave your abusive relationship, or that just means staying safe because you cannot leave your abusive relationship at this moment. Legal services that we provide is assistance with writing, assistance with filing, assistance with filing, what are they called?
The restraining orders?
Yes.
Yeah. As you had it, it was like on the tip of your tongue. I could see it.
With the restraining orders, they will also help with simple divorce proceedings. That is, the simplest as it get. And if we're not able to provide that, then we'll referral out. We also provide services with the filing for the immigration T visa and the VAWA visas. If we're not able to provide, we'll refer them to someone, to an outside agency. Then we also have crisis counseling and our 24-hour support line, which is available in English and in any language through an interpreter, 24 hours a day, 7 days a week, 365 days of the year. And that support line is used to ask for questions, ask for resources, or if you need someone to talk to in the middle of the night, they will be there. The other services that we provide is, right now, is our rapid response team, specifically for intimate partner violence. They will actually, it's working with San Jose PD whenever there is a response, if they want an advocate to go to respond to the scene when in instances where the police has been called due to a domestic violence call. And then we also provide support groups for children as well as adults in English and in Spanish. And they're working on to be able to get more support groups. Right now they're happening through Zoom because of the current situation. And we also have, as I mentioned, our healing center, our long-term therapy services. In terms of the community engagement and education piece, we are in different school districts teaching children so that we're able to break that cycle at the very young age. So people learn about boundaries. So children learn about what is a healthy relationship and kind of start at the very beginning. And we're in different school districts as well. And we're also out in the communities, whether that's churches, PTA meetings, coffee with the principal, and interacting with different organizations so that we can get the word out of what is intimate partner violence, what is healthy boundaries, and what is a healthy relationship. And I think I explained everything.
That's great. I mean, you have a lot going on. I think it's like the approach is great that you're hitting all those different points of like, the education and the immediate needs of people, with individuals and like the group therapy or group process. It's not really therapy necessarily, right? But to help people. Laura, you want to talk about Nextdoor and what you have?
Yeah, so very similar, right? A lot of our sister agencies, we have a lot of the same services. I like to think about it in some sections. So one is the crisis and advocacy services that we offer. So our hotline, it's 24/7 hotline, and then also walk-in crisis intervention. So we have advocates that are here in the office 9 to 5 every day, seeing clients. Right now because of COVID, of course, that's been impacted. Our hours have been impacted, but folks can still be seen if they wanted to see somebody today, like right now. Our legal advocacy is also part of that crisis and advocacy work. So we have, again, like Daniela mentioned, filling out restraining orders, legal clinics, going to court accompaniment. And then the other section would be our support services. So our self-sufficiency advocacy. So advocates work with survivors, maybe it's not the crisis in the moment, some time has passed perhaps. So we might have some workshops on credit, building your credit, computer labs, self-sufficiency sorts of things. Support groups, of course, pre-COVID, we had about 16 support groups in the community, both here in the agency and out in the community. Right now, they're all through Zoom. We are finding that a lot more folks are joining, which, it was hard for people to get to the office sometimes with transportation or childcare. And so we're finding for some folks it's been working out. We offer groups for women. We offer groups for men survivors of domestic violence as well. And we currently started our LGBTQIA support group, and we're looking for clients open to that. We're also doing that virtually right now. Our kids club is a space for kids to be in community with other kids while their parents are going through support group, also on hold right now because of COVID. And then our shelter and housing services. So our shelter next door, our Housing First program is a way for, is a program, primarily the goal there is to prevent homelessness due to domestic violence, which is, as we know, here in the county and all over the country, but specifically here in the Silicon Valley, how housing is just outrageous. And so we're finding that, these are kind of temporary things that we're doing. But again, when we talk about the systems, what is it we have to do in San Jose to secure more housing for our folks so they don't have to choose between housing and abuse at home. And then the work that we do on education and outreach that we do here, prevention work with our promotoras. We're trying to involve a lot more men and boys into the work, also working on pre-COVID 11 high schools on the east side of San Jose, working with male athletes and female athletes on a program called Coaching Boys into Men, where we focus on talking about consent, healthy relationships, rape culture, all of those things. And then a lot of work that's being done with our promotoras is in the medical medical field. So how do we talk about universal education? How do we get our folks trained to really not just assess, again, not the checklist of like, oh, she has a bruise, oh, he has, an injury, but to normalize it and say, what is it that's going on at home, include that as part of the medical questions that we ask. And so, yeah, those are the sections that we kind of, very similar to our sister agencies.
Thank you both so much. Obviously, no one is bored, right? And there's no easy solution. And I appreciate you highlighting the intersectionality. And I think also want to say how much I appreciate that both of your organizations have been great partners in terms of our outreach and education efforts on campus. And obviously, we want, part of the reason we're having this conversation is to help students be aware of the resources available to them in our community. And we want students to feel very empowered to utilize those services. I will also say, many of our students have had experience with the YWCA. We've had a close partnership in terms of the advocacy services to provide some 24/7 support that our staff can't necessarily provide. So we really appreciate the partnerships with both of your organizations and the scope of your work. So thank you. Shifting a little, although I think we've started to touch on the impact of the COVID-19 pandemic, because it's hard not to, in particular when you're having a Zoom conversation that we might have hoped to have in person. But, thinking about domestic violence, the research and the literature, and to some extent common sense, has shown that when families are spending concentrated time together, there can be a rise in the incidence of domestic violence. And so thinking about the pandemic and shelter in place in particular, and some of those changes to our daily life and spending more time potentially in our home or with the people living in our home, I'm curious to hear any trends that you might have noticed in terms of demand for your organization's services during this time of COVID and shelter in place, and what does that look like?
So immediately during COVID, right, a lot of people stopped working. And so housing was so we had an influx of rental assistance. And we are part of the Housing First, which is a county-wide. So at any agency, regardless of where you go, it's going to be it's the same program. But when you have like an influx, right, we only have like a certain amount of funding. And so that's definitely been a huge one, because it's not just the rental assistance is not just 1 month. We're in October already, and some of our clients are still not working. Some of our clients, many of our clients, fall into the marginalized communities, the low income, undocumented, that may not necessarily receive the benefits of unemployment or the extra stimulus, the stimulus check. So it's, how do we have that plan? How do we safety plan so that to make this sustainable? Because eventually, the money runs out. So that's definitely been a huge one. Not necessarily, also as well, there's been a higher influx in terms of calls to the police, but not necessarily to our support line. And that's when we say like the common sense. Obviously, if you're with the person that's causing harm at home, you can't really reach. There's not really time for reach out, or whether it is through chat or through the phone line. But because for obvious reasons, more people spending more time at home, it obviously creates more calls, especially on the weekends, especially at nighttime. So those are some trends that we have seen. Another one is specifically for our marginalized communities that may not necessarily have access to stable internet, that may not, that have had to learn how to use Zoom. Getting access to those services and that communication has been a lot harder. It's getting creative. Zoom is not always going to be an option. And so having to learn on the fly and adjust with our communities, and that yes, for us, hopping into Zoom might be something so simple, but for others it might not. And so it's how do we have these, these support groups when you have your children around and you don't want to have these conversations around your children. So it's like, it's coming up as advocates. Okay, do we create guides on like walk our clients through on how to create a Zoom account? Do we need to mail out headphones so that we can have our support group, so that we can have our classes? Does this mean that we need to have more flexible hours and it's not going to be a 9 to 5? This might be that it's going to be more like a 12 to 8 p.m. shift. So just being flexible in that aspect so that we are able to meet our clients' needs, and also understand that just like we're working from home, they're also working from home. Most likely they have children from home, and there's one laptop, maybe one phone, and the kids are using it for school. So we might not be able to do the same programming or the same services as we were prior to COVID.
Thank you so much, Daniela. I think you touched on a lot of points, and I saw a lot of head nods. I appreciate you also mentioning that, the media portrayal, especially of call volume, is really, not an accurate portrayal of what is happening in folks' homes, because sometimes calls go up at certain times when folks are comfortable or in a place where they can talk. But we also know that this creates some really difficult challenges in terms of having that privacy to utilize the services available. And so I think that's a really key frame to consider as we're looking at some of the reporting on trends that are happening, especially in the US. So just want to highlight that point, but really appreciate everything that you've brought up. Laura, what about for your services? Are you noticing any trends?
Yeah, I think similarly to Daniela and the Y, and I think overall in the county, initially the calls were low at the hotline, right? So initially the first few weeks, we didn't see as many calls, but that was expected. People were sheltering together. It was hard to get to a phone perhaps. And so after, a few months, maybe a month after, the calls started to rise. And now they're almost at the level they were last year, if not a little bit higher, right? So we're seeing that trend there. Again, the housing situation, I think what COVID has done is really highlighted a lot of the inequity in our communities when it comes to our marginalized communities, our women, our LGBTQ community, our elders, right? COVID has really put like the spotlight on how the inequity in our communities have been devastating these populations for years. It's not just since March. But I think given now that people are losing their jobs, there's a threat of eviction, right? Eviction courts are going to be opening up on October 5th. That's on Monday. So on Monday, landlords can walk in there and start filing eviction notices, right? And so COVID has really highlighted in this time what was already happening. We knew folks were falling through the cracks, like they like to say, but it's not. The system has been set up this way for a long time. And so the trends are, the trends that we have been seeing: people being displaced, people losing their job, people losing their medical health care. That's like I would say in the community. On a personal level, I think some of the things we're seeing is that COVID is being used as another tactic of power and control, right? So if somebody were being isolated from their community, now with COVID, this person that's causing harm is now using this as they're saying, do not go out, do not visit anybody. So it's an added layer of using this pandemic as a type of control for their partners, right? So we're seeing things like not letting them have access to hand sanitizer, or not letting them go to the doctor if they feel sick, because if you go, you'll get COVID and they'll take the kids, like all of these things. And so, or misinforming their partners about what's really going on. And we know there's a lot of misinformation out there about COVID. And so using the pandemic as another kind of spoke on that wheel that we use of control. That's another trend that we're seeing. So survivors are really in a tougher spot than they were pre-COVID.
Thank you. And I think there's a real possibility that some folks who are listening to this conversation may be thinking about their own experience and seeing some of the challenges that you've brought up reflected in either their experience or someone close to them. So can you tell us a little bit more about how students who may be relating a little more closely to what you just described can reach out to get support or access some of these services that you've mentioned?
Yeah, our hotline is 24/7, and a lot of times folks think if I call the hotline, that means like I need to go to the shelter right now and change my whole life, but it's really a chance to talk to an advocate about what's going on right now. No, I think in the years that I've been working with community impacted by domestic violence, not one person has said, calling the hotline, hi, I am experiencing domestic violence right now. I need a safety plan. Nobody's going to use those words ever, right? But we know something's going on with our partner. Something's going on in this relationship that we have. And so really having a space to talk to an advocate anonymously if they wanted to about what's going on, about asking questions, about saying, you know, this happened last week and I don't know what that is. I don't know what to call it. I don't want to label it. And just having that conversation for folks many times, and I can tell you for myself as a young person before getting into this work, if I had known where to call to say like, hey, this person has no boundaries. I'm being asked to do things I don't want to do, or I feel guilty if I don't do something this person wants. A lot of things could have been avoided, right? And that's like looking back in our lives, but I think not being fearful of speaking out when you're ready. Anonymously is always good because you don't, you know, sometimes when you say it out loud, it's like, wow, I've said it out loud to someone, even though they don't know you, you haven't said who you are. But I think if something inside of you is telling you something's not right, right? My spirit is not right with this person, with this relationship, in this job, in this, wherever we might find ourselves, that there is somebody there on the other side of the line to say, you know, I don't have answers, but I can listen. Again, offering that space. And so I would encourage folks to reach out if they have that, if you want to talk to somebody about that. You don't have to make decisions. No one's going to make decisions for you. We're going to start from where you want to start.
Yeah, I mean, Laura pretty much said it all. To me, like, I'm just going back into when I was an advocate and kind of the questions I would get, and I go back is at the very beginning when I first became an advocate, I had like my friends had the tendency of giving my phone number out to different people. They're like, oh, she's an advocate, and I'll be like, no, like give them the support line number. But some of them during that, when that would happen, it would just be like, hey, like this happened and I don't know what it is. So it's kind of like affirming that I don't think it's called domestic violence or intimate partner violence, but it doesn't feel right either. So kind of going, you know, that intimate partner violence is not just someone hitting you and then there's a bruise. There's other types of intimate partner violence, and going that and that your feelings are validated and what you experienced does not have to be minimized just because it wasn't physical. And so a lot of those conversations, a lot of the times that more than not, actually, the violence is not physical. So having those conversations and letting them know, hey, what you tell me stays between us. And if you do not want to involve the police at this time, we don't have to. So just letting them know that they do have options and that they do have that power to make their own decisions, and that just because you reach out, it doesn't mean that your partner will get arrested. And for survivors to be able to have that, it's kind of having a peace of mind, because sometimes their partner being arrested might be even more dangerous than not being arrested at this time. So just being able to have and having that conversation and being able to ask those questions and that you might not be sure. And you know, we don't really talk about these conversations on the regular. It's not like, you know, we sit down with our friends and have wine over and let's talk about the different types of domestic violence. And so people don't know, or that there is a name for it, or don't realize that this probably has happened in our own lives. And we didn't even think that, oh, that would never happen to me because I'm a strong, independent person. So just being able to realize that it's not okay and that we are able to set boundaries, and that just because they're family or because, as I mentioned, it wasn't physical, it doesn't mean, it means that it can be minimized.
Absolutely. Thank you for that. And I think, you know, a lot of us are thinking about conversations around personal boundaries and consent and having that communication with the folks in our inner circle in very different ways than maybe the health educator in me has thought about them, talking about healthy sexuality with folks because of COVID. So I think it's really important to normalize those conversations and remind folks that you don't necessarily have to have a solid answer about what or a label to seek out some advice and guidance and support. I do want to make a note that we will be sure to include contact information for both of your organizations in the podcast and in the marketing as well. So if folks are thinking, oh, but you didn't tell us what number to dial, we will get there for you for sure. Want to just highlight really quickly, we've touched on this a little bit as well, but can you just talk about how service delivery may have been impacted and how that might have changed, whether that's the process or how many services, you know, how many people you can assist based on COVID and the response and the shelter in place? Laura, I saw you shaking your head, so maybe we'll toss to you.
I don't want to take over. Yes, I think all of our services were impacted. So the first 3 weeks, you know, everybody was sent home, except for the advocates in the office. They stayed along. The shelter, of course, still open. And then as the weeks went by, you know, the advocates have always been here at the office. So initially we had a lower amount of folks coming through that we would see in a day. Sometimes we may get 15 walk-ins in one day, crisis walk-ins. Sometimes we'll get 2 or 3, so it depends. Right now we're seeing about the same amount as pre-COVID. So the numbers have not been impacted now. Shelter has been full. The shelters are always full in Santa Clara County. But I think that the biggest shift has been the work that we're doing, like in support groups have been all now virtual. All of our education, all of our, like some of the work that I mentioned that we were doing with Coaching Boys into Men, because the schools closed, we couldn't access those services anymore. And so trying to figure out how to do that virtually. It has changed the dynamics, right? Because we're not around our coworkers all day. And so when I do come into the office like today, I want to talk to everybody. I you know, it's like I said in the beginning, it's this kind of pull, right? It's like, oh, it's nice to be working on my own, and you get creative and you create all these things, and then you turn and you're like, oh, okay, I guess is it good? Is it good? You know, so the impact, I think, on services, it's impacted clients, it's impacted the community. I think there's also this, you know, sometimes clients would come in to see their advocate, but then would hang out and like use the phone or hang out outside and talk to other folks, or, you know, the social networks have also been impacted in the county, right? So people that used to go community centers or then come here, like this is part of their day sometimes. Like I'll go pick up my essentials. Maybe I'll get some food and diapers, and I'll pop in and talk to Laura about like some outreach we're gonna do. So all that is kind of not here right now. And so that's been very impactful, I think, for clients and for staff and the community. I think that we've done an amazing job in still holding down the fort, as we say. The advocates are amazing. I don't know, because you're taking care of the community and you're also scared for yourself at the same time. It's a weird place to be in. And so, yeah, I don't know if I answered the question, but yeah.
I mean, definitely it has impacted, right? From overnight, we had to go from in-person to virtual, and we had to continue business because domestic violence, intimate partner violence does not stop with shelter in place. I think I wanna really highlight the very specifics of working with marginalized communities. I think, I mean, me personally, whenever I have to reach out to my doctor, I just love emailing them, because I'm like, I don't need to go in person. Like, I already know. I'm like, these are my symptoms. Can you just prescribe, ibuprofen or whatever it is that you need to prescribe? And usually, and it's just a lot more efficient in my opinion. However, with our marginalized communities, they might not have an email address. They might not have a computer. And, we have to have confidentiality forms, and they might not know how to do e-signatures and all these different things. And we might just want to do them, or the rental assistance applications, or, a victim witness application. And and as an advocate, right, we want to help our community, specifically our marginalized communities. And we might just want to do it for them because it's a lot easier. The problem with that is, we are making the survivors dependent on us, and that's not what we want. It needs to be about the empowerment approach. So it might be very frustrating because something that might take me 10 minutes, it might take an hour and a half trying to walk the survivor through it. But the process is really important so that the survivor feels empowered that, one, it is their decision and I'm not forcing this on them. And two, the fact that they're doing it. And so that's really important. And I think that as advocates, I'm speaking for myself, that's, I got into this work to help my community, specifically my Spanish speaking community. And it's just I just want to do the best for them and get them the best services available. So it's just I just want to do it for them. And so, it just means that I need to remember that our community is intelligent, they are resilient, and they are capable of learning. And so that means that they are capable of learning Zoom, that they are capable of learning how to download an application. And so it's going to take way longer, but we're going to get through this. One of my coworkers had to help their clients file the unemployment forms. It was a 3-hour process, but they did it, and the survivor felt so proud and relieved that they were able to do it. And we shouldn't take that joy away from them that they are able to do it. So that's definitely changed, as well as our ability. It's sometimes really hard, when, especially in the community engagement part, you go to different community centers, you go to different schools, and that's how you spread the word of who you are. You have that interaction. Now it's just kind of depending on the current clients, the current volunteers that we have to spread that word out, because then giving out the Zoom link so that people have access to it. Yes, we have social media pages, but the people on those social media pages are already the people that are involved in the work, right? So it's just how do I reach the people not in our social media pages? And that's meaning having to get creative, partnering with organizations, clubs, groups that may not necessarily be at an intersection of gender-based violence, or that we think it doesn't. So it's just getting creative of how do we reach communities that normally wouldn't, or have no idea that we even exist, because those are the ones that need to know that our services are available, not the ones that already know that our services are available.
I wanted to add something to what Daniela mentioned, because I think I really appreciated the way that she framed that, because it's about building relationships with your community, right? I think any community organizer would tell you it's about the relationships. It's, if you don't have a relationship with your community, nothing's going to get done. And I think investing in community and building those relationships takes a long, long time, right? It's a mutual learning, it's a mutual respect, it's a mutual education that is going on. And I think that some of I'm always trying to look for the silver lining in COVID, because it's like there's things that are good that are going to come out of this. And then one of the things that has come out for us, and it goes along with a trend that we're seeing, is that our communities, like our Comité de Mujeres that we have, our promotoras, you know, we couldn't do traditional outreach into like community centers and the libraries and like all the places that we would go. We had lists and cities and all these plans, right, for the new year. And it's like, we can't go into those spaces. So what are the spaces where our communities are that are not being reached by tech, by, you know, Zoom, by all of this? And so we really started a education campaign early on in April on how do we get the information out to communities that are now more isolated than they were before. And so the comité decided to do outreach in grocery stores or the corner markets, right? Because not all neighborhoods have a supermarket. Those little corner markets, cenadurias, which is like, in English would be like a pop-up dinner or lunch, right? So outside their house, they're making, I don't know, pozole or whatever it may be. And so going and flyering at those places and talking about healthy relationships, bus stops, on the bus itself, once the buses started riding, and laundromats, right? So these are places where people are congregating that you wouldn't originally think, oh, let's do some outreach at these places, but that's where our communities are. Our communities are having to wash clothes. Our communities are having to go to the store, like all of these things that we're doing. And so we took that as an opportunity for them to like, what is a different trend? What is this? What is it? What is the community that we want to look like? Because yeah, a lot of the outreach that's done traditionally in agencies or in the community is geared towards white women with, you know, certain brackets, right? The movement was started by white women for white women, right? And so a lot of the things that we keep doing are not helping our communities. We're not talking about how the person that's at home with 5 kids, with, like Daniela said, with 1 computer, having to buy groceries at like huge costs at this corner market, and then having to go across town to wash clothes. How are our services impacting them or helping them? A lot of times we're not reaching them, right? And so the trend is here is like, how do you continue building relationships with community in the hopes of creating a new society, a new community where they are at the center of really telling us what they need and us following, right? As opposed to the other way around. And so for me, that's a silver lining. I think that I've grown a lot closer to that group of promotoras in the last few months, because we've met a lot more than we ever had in person. Before we'd have 1 meeting a month, and now we're like 3 times a month, right? And we're planning and we're talking, and they asked for a meeting just not to talk about work, but just to connect with each other. And so really the self-care piece, I know that's a piece that's kind of present for all of us, is what is that trend? How do we take care of ourselves and community? So for me, that's a silver lining of all of this horribleness that's happening.
Yeah, let's stay on that topic of self-care, because I know we have a lot of students who are interested in getting it, like in you know, becoming social workers and getting into these like kind of you know, community support, engagement, empowerment kind of education roles. So how are your agencies handling the emotional stress and the toll of working around these issues during COVID? And I know, you know, one of the major ways that we deal with stress, like in this kind of work, is to talk with coworkers and have coworkers around. So what are the ways that you are, as agencies, as individuals, helping to support the self-care of individuals doing the work? How are you self-caring for yourself?
I'll just say me specifically. I got a dog. I got a dog in March, and I had been wanting one because I knew if I had a dog, I had to walk him and I can take him to the beach. And it really has made a difference in my life. I know that not everyone can get a dog, but it's really you really have to put in the work. In the trainings, when we do the advocate trainings, I always tell our new advocates, a lot of the times we romanticize this idea of what an advocate is. And it's not just all, we're assistant survivors, but it's also like, like the shock of the pain of what the stories that you're hearing. I know there's been times that I would go to the hospital for an examination, and it would be the first thing in the morning. And then after that, I couldn't do anything else because I just couldn't. And so it's taking care of yourself so that you don't take that home. Creating rituals so that once you leave the door of the agency, it stays there. So that can look like something as simple as spraying some little sage, some sage, so that scent reminds you. That is listening a playlist so that on your car on the drive home, you're distressing and you finish the song. And once you finish the song, you leave it. That might mean taking a shower as soon as you get home. And so it might sound cheesy. It might sound like, oh, that's so like ritual or ceremonial, but that's important because, for one, we spend a lot of time and effort and dedication training our advocates, and we want them to stay, right? Like it's 40 hours for the DV, for DV and SA, it's 65 hours. That's a big commitment, both from our agency standpoint, but also from the advocates that they're putting in. And we want to make sure that they have a good experience, that they're not just, that they do not just feel that we put them in the deep water and then they're drowning. We want them to succeed. And it's important. It takes a village to be able to respond 24 hours a day, 365 days. And so we need them. It needs to be sustainable. And so a lot of it is talking to your coworkers, because the reality is no one else is going to understand. No one else understands the stories that we heard. Yeah, we can have like an idea of what we hear in the media of what domestic violence is, but then only your advocates, and a lot of that too is because a lot of what we do is confidential, so we can't really be talking about it in an outside space. And also, right, you don't want to bring this to the conversations. These are not conversations that you talk on a date. These are not conversations that you talk with your friends over wine. And I'm like, oh, how's work? And it's just like, well, let me tell you. So this is something that these special individuals only understand. And so that's why it's really important to have these self-care rituals so that you don't burn out. It's really important to tell your manager, I'm at capacity, I can't take no more. It is important to tap out when it's triggering you, because then you're not able to fully advocate for your client, and your client needs the best of you. And if there's someone else that can do a better job, then it's okay to tap out. And also asking for help. We're not carrying the weight of every survivor. So it's important to spread the burden around so that you don't burn out, because it is important. And our advocates are amazing. Some of them have been doing this for a long time, and they're just so creative in how they have been able to support their clients. And it's important to have that, and we want to continue having them around.
Yeah, I think definitely it's not work that you can do on your own and just kind of like, I'm just going to sit here and do my work and mind my business, right? Because you're dealing with people's feelings and people's emotions and people's lives. And I think for me, when I first started this work so many years ago, like I felt the pain that another person was feeling, like I felt their energy. And I remember taking that home. And I remember thinking about it and dreaming about it and wanting to, like, I'll bring them to my house. And like, you know, you get this idea of what an advocate is, and you're not saving anybody. People know how to save themselves, right? You're really there to witness and to walk alongside with them. But the rituals are super important. I think for me, it is about, it's been more difficult in the beginning of COVID, working from home, because it's like, well, okay, is it 9 to 5? Well, today I'll start at 11, and then I'll work a little, and then I also have a dog, so let me walk him like for the 5th time, and then dinner, and then you're working. So it's like, when does your day start and when does your day end? So it's been trying to find a balance at home. And in the office, it's been a lot easier. It's taken me many years to get to the point where it's like, I'm going to work and then I'm going to go, you know, but being at home, it's a lot more difficult. And so those rituals are very, very important. So starting off the day with the meditation for me is super helpful. Ending the day with a gratitude kind of journaling experience is very helpful, even though some days it feels like, what am I grateful for today? Like the world feels like it's going to end. Okay, we had a good dinner tonight, or we, you know, had my favorite drink today. Anything that kind of like centers you. For me, it's always been art. Or I'm an artist and a poet, and for me, that's been my way to release a lot of that energy and release a lot of the pain that I hear. Because I know that Nina was mentioning these stories, that there's certain stories that are going to stick with you for a long time. You know, my very first client ever, like I could still see her face, right? I still remember every single detail of what she told me happened to her. And that was like 25 years ago. But those things stay with you. They stay in your body, they stay on your cells. And so really finding ways to take care of yourself in the moment and in community. I think for me, also being part of organizations or groups in the community that are working towards dismantling these systems, that energizes me and helps me care for myself a lot more. So, but definitely the rituals, the spraying, yes, the sage, yes, the full moon sage, the new moon sage, all of that. Right? Like tonight's like everything, the crystals. I don't want to get a little too much right for folks, but anything that works for you that makes you ground and feel centered, you know, go for it. Yeah, you need to take care of you. It's hard to take care of community when you're depleted, when you're out, right, of energy.
Yeah, I think that's so important for anybody in this kind of work, or you know, to realize, or any sort of like social justice work or activism work, is that you can't take care of other people unless you're taking care of yourself. Mm-hmm. And so thank you for your wisdom and your tips of how to do that. I think it's essential that people learn how to do that, and to practice it, so that we can all like stay refreshed and renewed. I really think that the pets are winning in this in this situation. They seem to be getting more walks and more attention, but they're also, I think, essential for a lot of us to kind of maintain our own selves during this time. So
I'm just fearful at the end of this, when we have to go back to work. There's going to be a lot of anxiety, a lot of separation anxiety. So on his part and my part, probably. So
yeah, I know. Goes. I know, yes, my cats are going to be really sad.
My dog and I have never been separated.
Oh,
so I have no idea how that's going to be.
Yeah.
You have to practice that now. Go away for an hour or so. Mm-hmm. All right, I'm going to pass it back to Emily to ask. We have one final question for you all.
So one of our goals in coordinating programs and opportunities to learn more for October, being Intimate Partner and Domestic Violence Awareness Month, is to move our community, in all senses of the word, but in particular at SJSU, toward not just awareness, but action. And so could you tell us a little bit more, or how would you advise SJSU students who are wondering how they can become involved and really help to make some of those positive changes or impacts that we've discussed?
Mm-hmm. I mean, one of the things that we offer twice a year is a 40-hour training. And again, that's a huge commitment to make, to be able to help the community. but that's not the only way. The 40-hour training would be for folks that are wanting to work in, directly with clients affected by domestic violence or their children. So that's not for everyone, but there's so many ways to, there's a call to action, and there could be so many things under that, right? It could be getting involved in your school on putting podcasts together on what is a healthy relationship. What are some warning signs? What are some red flags? So, we had a group of students from Notre Dame High School last year. 2 students on their own created a whole event to highlight teen dating abuse, right? They came up with the idea, they came up with the concept, we supported them, they did it. And so if somebody wants to do something, it doesn't have to be connected to like, I need to do the training and have the certificate. It could just be what's going on in my community, in my neighborhood, in my family. Like if we start individually, there's calls to action there all along the way. I also like to mention that even if we're not getting involved directly with the domestic violence, like let's say agency or group, whatever space we're in, if we're working on a committee for housing, if we're working in a committee on racial justice or gender justice, whatever it may be, the intersectionality of domestic violence with those areas need to be woven together by folks. So, if I'm in a housing meeting, I'm going to bring up the fact that a lot of women are homeless because of domestic violence. If I'm going to a racial justice, I'm going to talk about how racism in this country supports the oppression of women and how gender violence is intersected with that. And so there's a way to bring these all together so we're not working in silos, because that's what happens, right? I'm working on housing, I'm working on DV, I'm working on sexual assault, and it's all connected. There's commonality there. And so I would say for folks that wanted to work directly, yes, we offer those trainings, and there's many ways to get involved and volunteer. Right now, very limited volunteer opportunities because of COVID. But we're hoping to, get back to some kind of normalcy. We're offering our 40-hour training next week. We're starting this month. It's full right now, but the next one will be in 2021 in the spring. And so folks that wanted to work directly with clients, whether it's in kids club, doing a support group, answering the hotline, going to court for court accompaniment, those are some of the opportunities that down the line may be available for folks to get involved with. But also outreach and education is very important. That's also a way for folks to get involved. You don't need the 40-hour training. It's a shorter training. It's about a 2-hour training, and become part of that movement of getting the information out to community. I think that's also important work.
Yeah, very similar to what Laura is saying. I think in part of the intervention of intimate partner violence, it comes with the prevention part, right? So it's in terms of how do you do student organizing with the clubs, the dorm, the sororities? How do we bring this information, and so that information is out there? So that can be creating graphics. One of our high school interns, for her project, she wanted to create a graphic in Spanish because for her mom and her sister. So something that they would know about what is domestic violence and what to call. So something similar of making it accessible. You just never know who's going to watch. So if that means putting the posters, at the coffee shops, at the bathrooms, at the centers where there's a lot of foot traffic. And it might also mean with what you're already doing. So if you are accounting majors, business majors, then maybe work on putting workshops on how to rebuild your credit, how to open up a bank account. If you're already volunteering at the food pantry, then it's how do we get the support to be able to help survivors that need the food and can't go to the food pantry. So it's kind of seeing of what is that we're already doing, and how can we relate that to gender-based violence, to intimate partner violence. And the intersectionalities are there. I'm currently in my grad program in urban planning, and it's coming from I'm always like seeing from the lens of gender-based violence. How do we make communities safer for everyone that free from violence? So it's just kind of thinking as a environmental justice, how does this also affect gender-based violence, and how do they go together? So do I love yoga? Can I partner with the agency so we can provide some comfort and some healing for survivors? I am an artist. I am an art major. I am an artist. Can we do some art healing activities? I am doing liberal studies and I am great with children. Can we help the advocates come up with curriculum so that they can provide for these students? And these are things that you're not doing working directly with services, but coming up with curriculum, it's a very difficult thing. And if you have the expertise of coming up, so then working with that. So there's just many different things. Journalism, like how can we do research, and so there's many different things that intersect with gender-based violence that you can volunteer, that something that you can do from the comfort of your own home. And it's just reaching out to see how your interests can align with the mission of these agencies and the mission of the movement.
Well said. I think, again, lots of head nods and just appreciate all of these fantastic ideas and putting out there that really an action that can be done from your own home, even just conversations with your family and friends. Especially a lot of us are watching a lot of Netflix or other streaming services or TV right now, and looking at how relationships are portrayed in the media. So that's one small thing that we can do, and then all the way up to the spectrum of getting involved and taking some of those trainings and really providing services, and all of those pieces are so important. So I really just appreciate the scope of opportunities out there, and I think it's a great reminder to folks that it's okay if you can't fall on this end of the spectrum. That doesn't mean you can't do something really important and impactful over here and in just one day as well. So I would also encourage our students, if they're not already, and again, we'll provide this information, but to follow both of your organizations on social media. I think that's an important way to find out about some of those opportunities to pitch in. And keep an eye on that. I know that's something that personally I really value. So thank you so much, not just for these wonderful ideas, but really for this entire discussion. For me personally, I feel really inspired and just grateful to have the opportunity to work with both of you and the organizations that you're representing, and now to bring this conversation to some of our students. And of course, I'm always grateful for the opportunity to work with Bonnie as well, but just want to really say thank you for the work that you have done, are doing, and continue to do. And we really appreciate your time and taking the time to share your experience and your thoughts with us today.
Yeah, thank you so much for joining us today.
Thank you for having us.
Thank you. It was really great to start off the month doing this together in community. So I'm very grateful to be invited. Thank you so much.
Thank you for joining our discussion today on intimate partner and domestic violence. It's really important that we know how to support ourselves and each other during this difficult time. You can connect with all of our organizations on social media. The YWCA can be found at YWCASV, Nextdoor Solutions at Nextdoor Solutions, Wellness and Health Promotion at SJSU Wellness, and the Gender Equity Center at SJSU GenEC. Additional contact information will be available in the show notes. Thanks again, be well, and see you next time.